Coming up on the Get Lean, Eat Clean podcast.
But the thing is, your ability to sleep is it's just a basic function of your body. It represents like all the different things you did that day. Because like if you were mega stressed out in the morning, right, and through that's still going to carry through your nervous system into that night of sleep. So everything you do throughout the day affects your sleep. Okay, it's not just 1 to 2 hours, screens off, blue block. Like, those are good practices, but equally as important, just going through the day, whether it's like getting outside in the morning, that's going to be probably one of the most actionable things, right?
Hello, and welcome to the Get Lean, Eat Clean podcast. I'm Brian Grin, and I'm here to give you actionable tips to get your body back to what it once was 5, 10, even 15 years ago. Each week, I'll give you an in-depth interview with a health expert from around the world to cut through the fluff and get you long-term sustainable results. This week, I interviewed Dr. Dylan Petkus. Dr. Petkus is a physician, researcher, and health optimization expert who takes an integrated approach to sleep apnea. We discuss the importance of sunlight to help with sleep quality, along with routines to implement to help with your sleep, how to naturally combat sleep apnea, the importance of box breathing to help with snoring, creating an optimal sleep environment, and his one tip to get your body back to what it once was. Really enjoyed my interview with Dr. Dylan. I know you will too. Thanks so much for listening and enjoy the show. All right, welcome to the Get Lean, Eat Clean podcast. My name is Brian Grin, and I have Dr. Dylan Petkus on. Welcome to the show.
Hello, hello. Thanks for having me.
Thanks for coming on all the way from Florida. A bit jealous.
It's a good place to be.
Yeah, for sure, especially this time of year. And you have a practice out there, medical doctor, sleep health expert. What led you down this path?
Yeah, so I mean, my own issues, my own frustrations with the system, and being able to help people virtually, in that sense, all over the world, and because when you're in conventional medicine, which, don't get me wrong, there's many things, infections and bone breaking and all that stuff. Yeah, sign me up for that very allopathic approach. But a lot of lifestyle things, less so, right? Because like for me, sleep was a big part of my personal picture, or whether some of the cases we see, whether it's chronic fatigue or autoimmune issues, thyroid, things that just kind of get covered up with like here's your thyroid hormone, okay. Call me in 40 years sort of deal. Or here's your, oh, you don't sleep, here's Ambien, knock yourself out, literally. But like, I get that's good in a pinch if you don't have a great solution otherwise. But just not very sustainable, or really targeting the real issues. So that's where my departure has been, to be able to ask better questions, have better approaches, and be able to really put the power back in someone's hand of like, hey, here's how you can change this with how you eat or your lifestyle, your routines, etc. So the health is really back in someone else's hands, as opposed to this external pill or surgery or whatever, what have you.
And did you start specializing in sleep like over the last few years? Was this something like you started sort of almost like a holistic approach about everything, and then you sort of gotten, because it seems like a lot of your content and stuff out there is all about optimizing sleep, which is obviously a big deal.
Yeah. So I'm not technically specialized or like a board certified in sleep medicine, where I just look over polysomnographs for 3 years in a row. Missed that bus, but being in primary care, family medicine is my background. You're on the front lines for these kind of issues, right? Because like one of the chief complaints, one of the most common ones is I'm tired all the time. What's going on? And then that's like a stone's throw away from asking, how's your sleep, right? So that's why we do focus a lot on sleep, because that's such a big gateway to so many different things. That's where things can really fall apart, because if you're not sleeping well, yes, life is miserable on top of that, for people who have sleep issues or for young kids or puppies,
Sure. Yeah.
But then also like your body can't heal. So if that's not in place, if you have another issue, okay, but if your sleep's not right, you're just going to be kind of chasing your tail in circles. That's why, a lot of people, kind of the main thing they come to us is like, I'm exhausted. I don't know why. I've done this, I've done that. And when it's a chronic ongoing issue, there's going to be things like sleep or brain fog, et cetera, that, point to deeper underlying issues. That's why we, hone in on sleep as a big part of that.
Yeah, I mean it is smart. I mean it's one of those things where like if you don't get your hands around quality sleep, like it doesn't really matter anything else that you do. Uh, I mean I could tell in myself I'm just getting good sleep. I'm usually pretty good at it, but I feel like it's something that I'm always trying to get better at, like sleep routines and even morning routines. What type of like principles or routines that you recommend your clients? I mean, I know everyone's a little bit different. Everyone has different issues, but around sleep, what are the sort of the main pillars that you talk about?
Yeah. So first, stop trying. That'll immediately make it harder to sleep because whenever you try to sleep, you don't. So there's that. So
Mm-hmm.
because the people I'll speak with or be like, yeah. So I'm like sitting here in bed. I'm like, why am I not like that? So um, it's a bit of a Zen art to it of like, trusting that thing. That's kind of the first thing because we can talk about blue blockers and eating a certain way, but kind of the first kind of step back is like, okay.
Stop trying.
Stop trying, but take action, but like stop feeling like you're trying because yes, the next day won't be pleasant, but the more it becomes a mental activity and preventative, that's sort of the primary barrier. So that's why being able to have kind of trust in the process, don't ignore it, but it's kind of the first micro step. Now, action steps, there's a lot of different ways in which we approach it. So like nutrition, nervous system, environment, your circadian rhythm, those are going to be kind of the first sort of dominant wave of pillars there. So I think one of the easiest ones is, I mean, really routines here, predominantly in the morning, right? And then also in the evening before you go to bed. And that's usually the one people will hang their hats on because it makes sense to sleep like that. Of where, okay, sleep's going to happen in 1 to 2 hours. What can I do before then? But the thing is, your ability to sleep it's just like a basic function of your body. It represents like all the different things you did that day. Because like if you were mega stressed out in the morning, right, and through that's still going to carry through your nervous system into that night of sleep. So everything you do throughout the day affects your sleep. Okay, it's not just 1 to 2 hours, screens off, blue block. Like those are good practices, but equally as important, just going through the day, whether it's like getting outside in the morning, that's going to be probably one of the most actionable things, right? Because that morning light, right, whether it's, still got out in, the outside today, I know it was like, bone chilling 27, which is, summer in Chicago, from my understanding. But, that morning light's going to pretty much activate your hypothalamus, okay? Because like light goes in your hypothalamic tract there. Then it's going to start to turn the wheels, so to speak, of your circadian rhythm. Think of it as like your on button, okay? Or even more accurate, it's kind of like the first domino in a set of physiological events that allow your body to do the morning things, right? Whether it is cortisol going up, okay, it's going to be a big part. It will shut off melatonin production. So like some people, when they're groggy, that's one component towards it. There's still some lingering melatonin, especially if you supplement it with it. But you want to be able to like kind of set your body into motion to be able to sleep better at night. Because the research is really clear, like when you're getting, bright morning light exposure from preferably, all natural, just like we aren't right now, that is going to set you up for better sleep at night because you have a good circadian rhythm set up in the morning there. So that's kind of like the first thing not a lot of people do. It is the morning component to it because we especially right now, it's January, like people, they're off to work and sun's not up.
Yeah. I mean, I'm lucky. I mean, lucky. Well, we've been trying to go for morning walk. We always go for morning walks with my dogs. We've gone on short ones these last like 3-4 days because of like negative temperatures and they can't be out. But typically, yes, that morning walk is something that is a staple in our routine. So, okay, so getting sunlight early. What else? What else throughout the day or towards the evening would you recommend?
Yeah, so let's just continue on the sunlight train. So getting sunlight throughout the day is going to be another one because if you like your circadian rhythm, it is basically the timing mechanism, and either you're going to do things to make sure the clock is nice and set, or you're going to have things in your environment that mess up the timing of your clock for you. Okay. So for instance, like we're on screens right now. Okay. This screen, I could set it to a certain like brightness or color temperature, and that could tell my brain, hey, it's noontime. Right. But it's, well, okay, it's like 11 a.m. as we're filming this. So like close enough. But
Sure. Mm-hmm.
if it was like 8 a.m. and I'm getting a noontime signal, that's going to throw things off. So whether it is like frequent breaks throughout the day, whether it is to get, again, sunlight into your eye, so to speak, don't stare at the sun. Don't stare at the sun. Did I mention to not stare directly at the sun? And then also being super mindful of like the light you are getting during the day, because whether it's screens all day, I mean, that's really the biggest culprit. That's gonna sort of program your clock in a different way, even during the day. So like,
What would you
there's
say?
research.
What I'm sorry, what would you say? I mean, some people just can't get out in the middle of the day for sunlight, like, or in the middle of the winter, and they're working all day inside. What would you say to that?
I mean, it's as simple as whether it's a few times, like, or just like once. Okay, because like, I mean, geez, not too. I mean, I haven't really been in a work environment where people smoke all the time, but essentially,
Sure,
like,
getting out.
how many people go outside for like a cigarette break? It's not going to stop them there here.
All right.
And not to compare nicotine versus solar exposure, but like the more you're addicted to be able to have like your circadian rhythm in a good place, and that drives that behavior, whether it is like literally 30 seconds that you're like, I can't feel my face, that's going to do a lot for your physiology, even with a small amount there. So just once, whether it's during lunch or something like that, you just peek outside for a little bit. That's going to go a long way, because the difference in the quality and quantity of light. Because like right now I'm inside, I got like a few lights on. Maybe it's like 300, 500 lux, if I had to guess. That's just a total amount of light from a source. If I were to go outside, it's probably right now, I'm in Florida, it's in the winter, it's probably around 90 to 110,000 lux. It's a huge difference
Right.
there.
What about red light? I'm sorry to interrupt. What about red light? Are you familiar with using red light perhaps during the day?
Yeah, so red light is really good for overcoming sleep inertia in the morning here. That would be one really great circadian use of it, because essentially there's a lot of different things that'll influence your circadian rhythm and the internal timing of your clocks. Okay, because your rhythm, essentially, think of it as like a clock in the kitchen, and anyone in your family can try to like change the time. Okay, whether that's you, your dogs, someone who just randomly comes over. So you want to make sure you got the right inputs to it. One input that's really important, we already talked about light, but also biochemically, you'll have things. Okay, so like you drink coffee with caffeine, that'll affect your clocks. Another one is a chemical known as adenosine. Okay, for anyone who's a biochemical buff, or maybe, I don't know, you just read biochemistry books for fun. ATP, adenosine triphosphate, that's like the biochemical energy currency of the cell. How it provides energy is you have this adenosine molecule, and then there's three phosphates, just like a tail, okay? And then your body will cut off these little phosphates, and that will make energy available, okay? Now, when you do this, when you cut off the phosphates, 1, 2, 3, you're left over with an adenosine molecule just kind of floating around. So over the course of the day, you acquire more adenosine, okay? And then the job at night, your cells, is to take all of the adenosine, all the phosphates that have separated during the day, and then put them back together, so that then the next day, you're kind of locked and loaded with more ATP and ready to go. But that doesn't always happen all the way. And when there's still a little bit of adenosine left over in the morning, like if you're groggy in the morning, then that's what makes you tired. Back to red light. So red light will increase this reaction that takes adenosine and adds on the phosphates, okay, which will remove that grogginess there. And that adenosine is a circadian signal. So if you're someone who is groggy in the morning, or I mean, again, like wintertime in Chicago, I think the sun rises, 11:59 a.m. But it's much earlier than that. But essentially, that will help kind of get your rhythm going in the morning.
Got it. And then towards the evening, I mean, I know we always talk about turning our screens off at least a couple hours before bed, and maybe even, having some type of blue light blocking glasses as well. What type of things do you sort of implement when towards the evening time?
Yeah, so I think blue light blockers or reducing I mean, really any artificial light is going to be really essential because, again, if you have like a typical light bulb, maybe around 5,700 Kelvin, that's very close to what the sun is at noon. So if you're getting that like 8, 9, 10 p.m., it's already a couple hours after sunset. That is not going to tell your body to release melatonin at night to help you have good quality sleep. So yeah, blue blockers are going to be really important. But the funny thing is, I know a lot of people, I mean, blue blockers, geez, how long have they been around? A long time. I think the first original one was, you ever seen infomercials for yellow glasses for older people driving at night? That was the first
Yeah, right.
blue blocker.
Oh yeah, I remember those. Yeah.
But even sunglasses will do the tricks. I know some people are like, oh, I don't want to wear whatever. But kind of the first, like, try it for yourself if this works sort of deal. Sunglasses will also do the trick because they reduce the quantity of light by about 95%. And then also they block pretty much all wavelengths of light, not just blue light, but like pretty much most of them. Yes, you can still see, but it will still have a improvement on melatonin production at night. Not as pronounced as if you did use a amber or red tint, but gets the job done for people who are like, I don't want to do this sort of deal.
Mm. And I know you've posted on this before, but foods to avoid before bed for better sleep. What type of foods should people avoid?
Definitely cheesecake, top of the list, but other so high sugar, okay, which would be cheesecake if you ever made one. It gets kind of gross. So anything that's going to lead to prolonged insulin by the time you want to be sleeping. And we'll work backwards from that for specific foods that would do that. But the reason is when insulin is high, melatonin can't be secreted. Okay. It's a very firm relationship. And we'll do a little detour later about like, but Dylan, what about honey and milk before bed? That has sugar. I hear you people. But essentially anything that's going to raise insulin is going to lower melatonin, lower sleep quality. Okay. So that's why when you see like research and literature on people or even like societies who tend to eat much later, right? Whether it's like Italy or, other similar cultures in terms of eating time, they'll have elevated rates of whether it's cancer, okay, or sleep disturbances and other things that are going to be linked to that poor sleep quality. Okay. So first thing isn't even like what to eat, really when. So like the more that can be further away from bedtime, the better. Obviously, like, don't go extreme and eat at 4 a.m. to make sure you're far away, but just a reasonable amount of hours where like most people recognize it, like when they feel like things are digested, because people know the opposite when they're just like sitting there and be like, ugh, you're like, that's not conducive in any sense. Now, the type of foods that are going to make that worse. So insulin, pretty much carbohydrate is going to be kind of one of the number one culprits with that. Okay. More carbohydrate ingestion, that's going to spike insulin. And then really that's like really the primary thing. If you are someone who's susceptible to reflux or GERD, whatever, everyone has their own individual trigger foods, whether it's like tomato, spicy thing, whatever it may be for you, really make sure it's just completely out of the equation there. Those would be the main things to avoid, really, like the close proximity in terms of time, and then also high carbohydrate load there.
And I know you talk also a lot about sleep apnea. What are some of the ways that individuals can conquer sleep apnea naturally?
Yeah, there's pretty much when we're thinking about this, I was just making a presentation on this. So with sleep apnea, you want to go through a sequence of sort of like little checkpoints, because sleep apnea is essentially you stop breathing at night and you need to kind of walk back from there in terms of being able to address it. So the first thing is kind of, I call it like the tipping point, okay? Because there's a certain point where you're breathing at night, sleeping, and then you're not. What happens? Was it bad luck? Like, why does this happen 30 times an hour? And it's because there's a certain like choke point, okay, or like a narrowing in your airway. And then eventually it just kind of collapses in on itself. Okay. So what you need to actually do is actually retrain your breathing first, because the reason this like kind of folds in on itself is because people are over breathing at night, which I know makes very little sense because I just literally said people stop breathing. So what happens is people will overbreathe and overbreathe. Their inhale exhale will start to get really high in terms of volume, and then that increases it's called shear force. Yes, we're going fluid Newtonian mechanics here, but that will kind of drag the walls of your airways towards each other and then kind of block them off like that. Okay.
Yeah.
You can almost think of it like, like on a windy day when you have a curtain through a window and it kind of sucks the curtain and it gets like kind of stuck up against the mesh there. That's exactly what happens, except in your throat with something. So
are certain people more apt to getting sleep more apt to getting sleep apnea?
Yeah. So so how you get there, kind of I guess from ground up to being at the tipping point. So yeah, there will be like a start point of some sort of airway narrowing. Now, when that is present, it's a non-problematic airway narrowing, because 60 to 80% of all adults in the United States have some sort of airway narrowing, whether that's an overbite, whether that's large adenoids, whether that's a posterior tongue placement. 60 to 80% have that going on. There is a, confirmed, okay, because people have all these estimates of like, does everybody have sleep apnea? But there's a confirmed 2% diagnosis of sleep apnea across the United States. So there's this big discrepancy, right? Like let's say 70%, 2% have it. So why does one category become the other? Because as time goes on, people will just accumulate metabolic damage, right? Whether it's improper diet, physical activity, stressors, bad routines, bad sleep, then that leads to inflammation. Okay. So now this non-problematic airway narrowing, well, when things get inflamed, do they get bigger or smaller? They get bigger. So then the narrowing gets more narrow. And then that's when essentially now your body is trying to breathe through a straw at night. And if you had to breathe through a straw if you were trying to run, are you going to breathe more or less to offset that? You're going to breathe way more. And then that comes back into the overbreathing problem that then will kind of sort of snap things shut like that.
So solutions to help with sleep apnea, would you say, obviously, I mean, if you are, overweight or, eating processed foods or things like that, like normal things that individuals could potentially do to counteract sleep apnea.
Yeah. So with the weight thing, that's another interesting one, because when you look at the epidemiology or people like losing weight with sleep apnea, because one of conventional medicine's favorite scapegoats is we don't know what's going on, lose weight sort of deal, because it's just easy. Because if 60% of people coming into the office are overweight, you're gonna be right at least twice a day. So when someone who's overweight and has sleep apnea is about 20 to 40 pounds, which is not a small amount if anyone's ever lost that much weight, their sleep apnea symptoms will improve by about 10%. That's not a whole lot.
Yeah.
That's not really like a significant amount.
Mm-hmm.
And then also, general population without sleep apnea, 60%, 65% overweight. Population with sleep apnea, 70%, not that much different. And then also, what about this other 30%? Like what's kind of going on? So it's more so, think of it the inverse of where someone who's inflamed is more likely to be overweight. And also this inflammation will then precipitate this breathing issue here. So anything, and this kind of ties back, like whether it is how you eat, because processed food, that's going to trigger inflammation, right? Or maybe someone's sensitive to dairy, and dairy is one of the, a common culprit people can identify with, like, oh, I eat dairy, I get congested. Well, that's going to narrow your airways, and that's going to cause big issues. So diet's definitely a good area to look at. Like, what are you eating that is inflammatory? Whether you're eating, you're drinking, those sorts of things, you want to be able to identify what's inflammatory there. Okay.
Mm-hmm.
The other big piece is also how you breathe. So you want to, if you're over breathing, then you just want to pretty much train yourself to under breathe. And then you'll kind of fall in that middle zone.
How would you do that?
Yeah. So the easiest way to start, because it gets pretty complex, but a lot of people are familiar with box breathing. And what I like people to start with is something called it's rectangular breathing. It's a little bit extended from that. And so what I mean is box breathing is typically 5-second inhale, 5-second hold, 5-second exhale, 5-second pause. And you just repeat 5 in, pause for 5, 5 out, and then 5 pause. Rectangle breathing, you just make the pause 10 seconds.
So breathe, pause, exhale, all within. So rectangle breathing would be breathe in for 5, hold for 10, breathe out for 5, hold for 10. Okay, yeah, got it. Okay.
Yeah, I know it's confusing when I'm just
no, yeah. Well, I know, like in meditation, there's different ways to breathe and stuff, and so this would be one way to help potentially with sleep apnea. What about with snoring?
Same thing. So because the snoring is just the turbulent airflow before that full closure in the airway. Okay, because for instance, if I just blow air like this, like no one can hear it. If I pursed my lips together and blew, and I won't do that, you would hear a whistle. Okay.
Right.
And the reason for that is because when you have airflow in a smaller and smaller radius, it's going to cause, if you want to think of it as like friction, right? That's going to cause a sound. So snoring is just your airways are, just getting there. That's why snoring is like present in like 95% of people with sleep apnea. So doing these breathing exercises are also like, reducing inflammation or, there's a lot of different ways to reduce inflammation. That'll reduce snoring there. Now it does depend, like say if someone has enlarged turbinates or something like that, you would want to do maybe like some more specific nasal breathing exercises, whether it is just simply, it can be as simple as doing box breathing, but pinching your nose when you're not breathing through your nose. Because when you pinch your nose, this will restrict blood flow for a little bit. Okay. And then when you release, then blood flow comes back in, but that will essentially train or retrain the nasal arteries, predominantly the arteries, to help with vasodilation and vasoconstriction by themselves. Okay. Because when they can vasoconstrict, that again opens up the airways through your nose, and then will reduce snoring through that, nose, turbinate, palate sort of pass.
So you're saying practice breathing while pinching your nose, or
so you could just like stack the nose pinch on top of the box breathing. So like inhale, and then as I pause, pinch my nose so I sound ridiculous, and then exhale for 5 through your nose, and then pinch again for the 10 seconds, and then inhale, et cetera, et cetera. Because just that little mechanical pressure, that will help retrain those blood vessels to help with keeping airways more open.
And what are your thoughts on mouth tape?
I think mouth tape is a good bridge from someone who is like kind of okay to really like optimizing breathing at night. For some people, like, cause some people come to us like they're like they couldn't sleep without a CPAP machine. That's not appropriate for them because they still have some ways to go before they would consider using something like mouth tape. But I think if you're someone who like overtly does not have sleep apnea, and you want to like try optimizing your breathing at night because you're suspecting whether you got dry mouth in the morning or little things like that, or someone says you're snoring, you could go with some mouth tape, and that can help you cross those last like 10-20%.
Yeah, I've been testing it out a little bit, so I was curious. It definitely takes a little while to get used to, but I don't mind it. And I know there's a lot of companies that have come out now with mouth tape, and it seems a bit strange at first, but you sort of get used to it, and then it sort of trains you just to breathe through your nose, which is better than breathing through your mouth any time of the day.
Mm-hmm. Yeah.
Okay, and then what about, so we got sleep apnea, so habits at night we talked about already. Pretty much not eating too close to bed, which is really important. Getting daylight, sunlight is important. Anything else that, and obviously, eating foods that will only serve you in the evening, which, things that will raise insulin a lot. Obviously, you want to avoid, like cheesecake, you mentioned, and any other things that you come across with your patients, or tips that you'd give for them for restful sleep.
Yeah, cheesecake for breakfast. It's a breakfast food. So
Yeah, you're better off if you're gonna
yeah,
have it,
it's
right?
better off. You're gonna put it somewhere.
Yeah.
So covered nutrition, covered breathing, and then also like your sleep environment super important.
Yeah.
Okay, so whether it's like light coming in, air quality is super important. So like, and this depends on where you are. So if like you're down here in Florida, it's going to be humid. You want to make sure it's not too humid, right? But if you're up in Chicago and it might be a little bit too dry for you, you want to make sure you got the humidity right there. Because again, if you have sleep apnea, by definition, you have inflamed airways. Period. End of story. So if the humidity is off, then that's also going to potentiate and further exacerbate the inflammation going in and out. But also with like whether it is like, it can range from like the pillow you have is like 15 years old and like filled with mold, which is delicious, or even the tubing on a CPAP is again some old thing that has like crud going in and out of it. You really want to make sure your air quality is at a good place. And that could be from either, really opening the windows if you're in a non-urban environment would be a good practice there, or even like an air purifier, as long as it meets the standards, works for you in your bedroom and all that. That's another big.
What about sleep position?
Sleep
Thoughts on
position
that?
is it's a good one. It helps you kind of stay on like one side of the tipping point, if you will, because if you're like on your back and all your tissues are kind of sort of there, it's obviously not going to be a great way. Or if like you're on your side, you're going to have a better sort of posture in those airway muscles. But the bigger benefit of being on your side is like you're less likely to roll into your back there, or kind of like be forward. So it's not like the best thing I would rely on, because just because you start in a sleep position doesn't mean you stay there, because it's kind of a incontrollable thing for people. It can help a little bit, but doing the breathing exercises as you drift off sleep, because that will be a bigger factor, because essentially it'll set the rhythm for how you breathe at night. So you're more resilient to postures, as opposed to being dependent on only one out of like 4, 5, 6 sleeping positions.
So there's not one position that you would be like, oh, maybe you should avoid that. I mean, obviously sleeping on your side with your arm up, and that could be detrimental to your shoulder. I've run into that. Obviously I don't sleep like that anymore, but like whether you're a back sleeper or side sleeper, there isn't like one right way to do it per se.
No, there's really no one sleep position to rule them all. I think, the only thing I feel comfortable saying that about is if you're pregnant, don't sleep on your right side. If you're really pregnant.
No. And then what about someone that's maybe on a CPAP? What's the best way? What's some solutions to get off it?
So doing what we talked about, and then also being able to intelligently wean off of it, because the main setting is going to be the pressure on this thing. It's just kind of continuously putting air down your airway, hence the name CPAP stands for continuous. And that's going to be one of the biggest factors you want to modulate. Now that can be tricky for people. Some people, they can adjust it themselves. Others, they have to like speak to their, sleep doctor or whoever prescribed the machine. Like, hey, I think I can go from 10 to 8 or 8 to 7, whatever it may be, or 7.5. So it goes through phases of like making sure you're getting the best sleep that you can with a CPAP. Okay. Then once that's stable, reduce reliance on it. And that is going to be reducing pressure. Reducing time is tricky, because like, I don't want someone to set an alarm like, hey, rip this off 4 hours into the night. That's just not what you want to do. Right. So pressure is the best one. And then as you get to the lowest pressure, then you would see how you would do without it there, right? But that's only at a certain level would that be appropriate there. And you want to have some other method in place to track, like, okay, we've come off the CPAP. How are things doing? How's oxygenation? How's how are you feeling in the morning? All those factors.
And then, are there any supplements that you use as far as helping people with sleep?
It depends on a lot of their metabolic issues. There's not because there's just not like one size all fits, or I guess sleep supplement, because just hammering things like melatonin, that's not really reliable one, it's beyond 6 months, not really effective for majority people.
Mm-hmm.
But like a lot of what we focus in on is helping the metabolic issue with someone's mitochondria. Okay. And if we want to use a supplement to help sort of offset any deficiencies or imbalances they have, then we will use that. And then by doing that, then that would help sleep.
Got it. So you wouldn't obviously start with supplements, but perhaps if it needs to come into play, you'll use it.
Yeah.
Great. Okay. Where's the best place for people to find you?
Yeah, I mean, if you have sleep apnea, the thing I'm probably the most active in right now is our free Facebook group, which is the sleep apnea solution there. We have our Instagram, which is Petkus, Petkus, Petkus MD, there, posting there. That's probably the most active places.
Okay.
There. We have our website, but really the group or the social media would be
the best
active
place. Yeah, more active, your Facebook group and things like that.
Yeah.
And then I always ask my guests one last question. If you were going to give one tip to an individual that was looking to get their body or their minds back to what it once was when maybe 10, 15 years ago, what one tip would you give them?
I think have a very, very strong reason why and be able to like reconnect with that at least once per day. Because I see too many people like reaching for the next biohack thing, but some of the basic things are just like maintaining consistency and motivation, and be like it just falls up. It's just funny. It's like people are like, should I get a red light therapy bed? I was like, no, I think you should just like stop using your phone at like 9 p.m. at night. So like
right.
the more someone's connected to the vision of who they want to be and what that means, a lot of those habits fall into place a lot more easily.
Yeah. I love that. Excellent. Well, I appreciate you coming on, Dylan.
Yep. Thanks for having me.
Yeah. And have a great rest of the day.
Yep. You as well.
Thanks for listening to the Get Lean, Eat Clean podcast. I understand there are millions of other podcasts out there and you've chosen to listen to mine, and I appreciate that. Check out the show notes at briangrin.com for everything that was mentioned in this episode. Feel free to subscribe to the podcast and share it with a friend or family member that's looking to get their body back to what it once was. Thanks again and have a great day.